Hello and welcome to a special interview for The Wire supported by Glenlivet Books. Now that Omicron is clearly established as the dominant variant in India, is it time for us to rethink our public health strategy for tackling coronavirus? That's the key issue I should put today to one of the world's most highly regarded experts on public health, Professor and Dean of Brown University School of Public Health, Professor Ashish Jha. Professor Jha, now that Omicron has clearly become the dominant variant in India, and given that it is far more infectious than other variants, but also given that the disease it causes is considerably milder, do we need to rethink our public health strategy for tackling coronavirus?
First of all, thank you for having me back, Karan. Yes, I think we do. This is a variant that is going to be very hard to control in terms of its spread. We should still attempt to do so. I'm not suggesting that we don't. But because of two things, one is it is a little bit less severe. But more importantly, there is so much immunity in the population now in India that we have to take a different approach. We have to start thinking about this variant as the transition variant, the variant that transitions us out of thinking about the acute phase of the pandemic, and more thinking about what life will look like in an endemic coronavirus.
So does that mean that the stress hereafter should be mainly on hospitalization, ICUs, ventilators, and of course, heavily emphasizing the need to wear masks, rather than continuing the old focus on testing, tracking, and tracing? Is that the change you have in mind?
It was some. I would still say testing is an important feature, but testing, tracking, and isolation as your primary strategy was going to be very, very hard with this virus, with this variant. There are a couple of things I would say. First is we should think about what are the strategies we want to use to keep infections low. We don't want to let infections run wild. But second, and this is to me the really important shift, is we must think about how do we prevent people from getting hospitalized, going to the ICU, not just because of hospital and ICU capacity, but of course, we don't want people getting sick and dying. And that means making sure people are vaccinated, making sure vulnerable people are boosted. Those become much, much more important part of the strategy. In terms of keeping infections down, mask wearing, certainly, avoiding large indoor crowds. There's still certain things that are part of the original pandemic playbook that are at play here. But to me, the emphasis shifts a little bit away from all of those infection mitigation strategies to really making sure that we're protecting people who are going to end up getting really sick and in the hospital.
So in a nutshell, testing, tracking, and tracing does not have to be the primary focus of your strategy. Its priority slips considerably lower down.
Absolutely. And in terms of the goal of keeping infections low, masking is very, very important. Indoor gatherings, large indoor gatherings, that's still where we're seeing the big spread. Those are things where I think we want to pull back. We want to be careful because the goal here is keep infections reasonably low. You're not going to be able to suppress it. You're not going to be able to get to COVID zero, but don't let the infection run wild. And I would really focus on those two areas of masking and indoor crowd management.
I'll pick up on the points you just made in a moment's time, but let me first put to you and get your opinion about the new guidelines that have been issued in the last week or so in India. The government now says that asymptomatic people who come in contact with someone who's infected do not need to be tested unless they show symptoms themselves. And secondly, the other change is that there is no need for random testing of asymptomatic people at bus stops and metro stations. Do you agree with both of these changes?
Yeah, so let's talk about I largely do agree with these changes, but let's talk about what and with a little bit of nuance, which I'll get to in a second, but let's talk about why these changes are even being proposed. The whole point of testing asymptomatic people before was that we knew that there was a long period of time, several days, where people could be asymptomatic and spreading virus. And of course, that's what we want to capture. And we want to help isolate those people. What we're learning with Omicron is that window may be much, much shorter. that people develop symptoms very early in their disease. And so that asymptomatic, what we call pre-symptomatic period, is actually much narrower. And that's one of the reasons why doing large-scale testing of pre-symptomatic or asymptomatic people may be less useful with Omicron. So that's kind of point number one. I think point number two is with widespread infection, it's just going to be hard to pull off. I mean, when you have hundreds of thousands of infections every day, it's going to get harder and harder to do that kind of thing. On the issue of quarantine, if you've been exposed to somebody, the one place where I would do it a little bit differently is I actually like the guidance that the CDC in the United States has put out, which is if you are exposed to somebody, if you are vaccinated, particularly if you're boosted, you do not need to quarantine. But you should get a test about 5 days later, just to make sure you have not gotten infected. So not testing every day, not going into quarantine, but getting one test 4 or 5 days after exposure. I actually think that's a bit of a better strategy because you are going to find people who are converting just around that time. And it'd be great to get them before they spread it to other people.
Now, like the United States and like England, India has also cut down the period of quarantine necessary, even if you do get infected. It's reduced to 7 days, provided for the last 3 days you don't have fever. Does that sound right, given that it's Omicron we're talking about?
Yeah, that's pretty reasonable. So every country is doing it a little bit differently. In the US, the strategy is go to 5 days after symptoms, and then stay masked up, wear a mask for the next 5 days. England is also using 7 days. I think India's use of 7 days with no fever for the previous 3. Those are all very reasonable. Here's the key thing people need to understand. You are most contagious in that first few days after symptoms begin. So when symptoms begin, that first 3-4 days, you are highly, highly contagious. By day 5, day 6, your contagiousness, even if you are contagious, you're much less so. And then a lot of people are no longer contagious by day 7, 8. So these are all reasonable strategies. Just to be 100% clear, day 7, India's day 7 strategy, very reasonable. Not 100%. There are going to still be some people who are going to be contagious on day 8, day 9. My personal thing is after day 7, if you can get a rapid antigen test, one of those rapid tests, and it's negative, you're going to feel much more comfortable that you're not contagious. But the strategy India is using on this is both consistent with other countries and a pretty reasonable strategy, because the key is we want to isolate people in those first few days.
Well, I think the government will be hugely reassured to hear you endorse in fairly substantial measure the strategy they've adopted. But let me put to you some of the concerns that have occurred, not to the government, but either to some experts, but more often to ordinary lay people. And I'll use Delhi as an example. People say that the total number of tests as a result of the new guidance has come down fairly substantially. At the same time, the total number of people who are detected as infected each day has also come down. But the positivity rate in Delhi remains above 20%. Is the high positivity rate a problem?
It is. High positivity rate is a problem. It does mean that we are under testing, that there are a lot of people out there who are infected who are not getting tested. Whenever you see positivity rates above 10%, certainly above 20%, it means you are missing a vast majority of infections. Now, most of these tests are still PCR tests, or many of them are. Actually, I don't know if that's true. Are they mostly still PCR tests?
I think they're roughly about 50-60% PCR and the rest are rapid antigen.
Yeah. So I would look at those two differently. For PCR tests, you have to remember, PCR tests can remain positive for weeks on out. And so a positive on a PCR test means something very different than a positive on antigen. And so we really want to look at those two tests and the test results differently between PCR and antigen. And antigen positive means that you're actually contagious right now. But that all said, Karan, I think the key issue is whenever you have positivity rates of 20% or more, you should assume that you are missing 70, 80% of cases that are out there.
So the message to Delhi is, and as of today, the positivity was 22.5%. That level of positivity means you're not testing enough and you need to be testing more, even though the variant is Omicron. That is not
Absolutely.
a reason for reducing your testing and accepting a high positivity above 20%.
And there are two reasons to be doing more testing. First is you want to have people who are infected should know for their own health, which is one of the reasons you don't want to be missing most of the cases. And second is, especially if you're using antigen tests, you want to tell people when they're contagious. And if they're positive, they will self-isolate for those 7 days, and that will slow down the level of infections in the community. So more testing, I would say more antigen testing, and you want to try to see those positivity rates go down.
So I'll sum up this bit of the interview and ask you if I've understood it correctly. What you're saying is that under Omicron, the priority and importance of testing, tracking, and tracing comes lower than it used to be under Delta. You need to be more concerned about ensuring mask wearing, ensuring hospitalization, ensuring people don't fall ill and get vaccinated. But, and there is an important but there, if your positivity levels are at 22%, which they are for Delhi, the need for testing remains important. And you can't say this is Omicron, it will spread wildly, therefore we'll test less and live with a higher positivity. That's a double message you're giving.
Yeah, and let me explain that second part, because the second part may feel like a contradiction to the first part. So let me explain why. When you're at 22% positivity, it means, as I have said, that you're missing 70, 80% of all the infections. So what's the problem with that? That means infection numbers are spreading widely. It means you're actually going to have a harder time protecting vulnerable people. It will mean that you will see a lot more infections leading to hospitalizations and deaths. So even though I have argued that the primary purpose at this point should be to prevent hospitalizations and deaths, you're going to have a very hard time doing that if your positivity rate is 22%, because it means most people who are infected are not aware that they're infected, and they're going about their business spreading the infection, including spreading it to vulnerable people. So one of the key reasons you want to get that positivity rate lower is you want to let people know if they're infected so they don't then infect vulnerable people, elderly people. A healthy person doesn't go visit their elderly parents if they're infected. That's what we want to try to avoid. With 22% positivity, you have a lot of people walking around infected, but they don't know it.
One more question on this issue before I go on. I hear the point you're saying that testing is important, particularly when you have positivity levels of 20%, because you want to ensure those who are infected don't go and infect others. But given the infectiousness of Omicron, a lot of experts say at best, you're only going to be detecting through testing somewhere between 5 and 10%. And therefore, since you're missing 95 or 90%, you shouldn't be putting that stress on testing. How do you respond to that?
Yeah, first of all, I don't think you're missing quite that much. So I would say that it's probably like you're missing 75, 80%, but still, let's assume that, let's agree that we're missing a lot. So the question in my mind in these policies always is, what are the costs and benefits of doing this? So I would say, if you do more testing, if you make testing more widely available, particularly antigen tests, that is something that India has plenty of capability of doing. India has a very good infrastructure for having more tests available. It has done more testing in the past. So it is not like, oh, these tests are not available, we cannot do it, it would be very costly. It is very doable. And the benefit will be that the more people you catch, the lower you will bring down the infection numbers, underlying infection numbers, because when you identify people, they will isolate and they will do less spreading. So absolutely, I would push for more testing, not because it's our number one strategy, not because it's going to completely shut down Omicron, but there is very little cost to doing more testing and a moderate size benefit of doing more testing. And so with any policy, you never ask the question, is this a good policy or bad one? You say, what's the cost of this policy and what's the benefit of this policy? More testing, the benefits to me clearly outweigh the cost for India.
Okay, let's then come to lockdowns, curfews, and other restrictions. Do they remain as valid a strategy under Omicron, or is this again something that needs to be rethought?
I think it has to be rethought. And there is a range of restrictions you can put in for slowing the spread, right? And they can be from strict lockdowns, like the kind we had back in March, April of 2020. Those are, of course, the most extreme versions, to much milder versions, like, hey, let's close cinema halls, let's close indoor dining for a while. Let's ask for mask wearing in indoor spaces, but let's not go to full lockdowns. I think at this point, with spread happening as much as it is, those milder restrictions are still pretty reasonable, right? They will help lower the spread in the community. Strict lockdowns are very, very costly and I think no longer necessary. And it's not clear to me people will adhere to it. It is not clear to me that it will make enough of a difference, and it's very costly to implement. So what I have been recommending to governments really around the world that are seeing an Omicron surge is think about what are those milder restrictions you can put in that don't have the same level of social cost, but will provide some amount of benefit in terms of keeping infection numbers lower.
Now, I hear your endorsement for what you call milder restrictions, but let me once again use Delhi as an example and put to you what could be a conundrum. Maybe it's not. At the moment, 83% of hospital beds in Delhi are vacant. 82% of ICU beds are vacant. Yet, in this city, we have night curfews, we have weekend lockdowns, schools, restaurants, cinemas, and gyms are closed, and all private offices have to work 100% from home. Given that the vacancy of beds in hospitals is so huge, are these restrictions valid? Or is this an over-restriction?
Yeah, so the approach I would take is, given that you have room in the hospitals, and again, you don't want to fill up those hospital beds because that means there are going to be people who are going to get sick. But given that there is room, that does give you a bit of a pressure valve. I would look at that list you just gave me. Schools, for instance. I don't understand why schools are shutting down at this point. We have very good evidence that we can keep schools open safely, including in the Omicron surge. So to me, there is almost no argument, no reason for shutting down schools at this point. That to me is an overreaction. It's going to have huge costs. If you think about the health and well-being of the Indian people over the long run, educating our kids is got to be one of our top priorities. So that is a high cost, low value intervention. 100% work from home, I think you should make work from home more possible, more feasible, encourage it. There may be offices where people can work from home quite easily. But I think weekend lockdowns also strike me because, again, look, there's two things happening here. I mean, one is, of course, we want to protect lives, but also we're 2 years into this pandemic. People need to be able to have their social lives. People need to be able to see each other. Tolerating a little bit more of that activity is, I think, pretty reasonable given pretty highly vaccinated population, given that you have plenty of capacity in your healthcare system, and given that we have other means of protecting, preventing very large outbreaks. So that all feels a little bit more restrictive to me than I would recommend.
Okay, that is again very clear. Given that you have 80% beds in hospitals vacant, 80% beds in ICUs vacant, you can afford to be a bit more lenient. Schools for sure should be open, but maybe you can find a way of allowing restricted dining facilities to open, even if not cinemas. In other words, people have a need to socialize. Don't completely stop it, because then you won't get obedience for the restrictions when you really need them.
And this is actually the key point. That last thing you just said is something that I think is absolutely essential, which is this is not the last variant we will deal with in this pandemic. And so the reason I described it initially as a transition variant is we have to look at this variant and ask the question, what are we going to ask people to do 4 months from now? When there's, let's say there's pi or rho or go through the Greek alphabet. Are we going to keep doing this? And for how long? And what's the strategy? And so there is a cost to overreacting, which is over time, your ability to use these tools will get less and less. And I do want to be able to say that we should have fewer restrictions, but if we get a variant that's very deadly, we will want to put in more restrictions at that point.
Absolutely.
But if we have used up that opportunity here by going overboard, I think that'll be really problematic. So there is a reason to be as judicious as possible in how many restrictions you put in.
Absolutely. This is a bit like that story, don't shout wolf when there isn't one on the horizon. Otherwise, when there is one, your shouts will be unheard. Now, let's look a bit down the road with you, Professor Jha. There are 5 state elections happening, and voting will be somewhere between the next 3 weeks and the next 6 weeks. And they're happening in critical states like Uttar Pradesh, Punjab, Uttarakhand, Goa, and Manipur. At the moment, the Election Commission has banned outdoor rallies, but it's permitted indoor rallies with up to 300 people, provided 50% of the space is empty. From a public health viewpoint, is that the right response and mix?
No, I would, 50% space indoors is good. It's not good enough. Now, you could make it better. And what I don't know is if they're requiring everybody wear a mask indoors. That would help. But in general, and going back to everything we have learned about this virus, outdoor activities are generally reasonably safe. Now, we've all been to and seen those rallies. They can be very, very crowded. So if I were advising the Election Commission, I would say keep outdoor rallies, but actually reduce their crowdedness a little bit. So maybe put in some restrictions on how crowded they get. If you're going to allow indoor rallies, make sure everybody is wearing a good mask. That is what allows this to happen. But having indoor rallies where people are not wearing a mask, even if 50% of space is unused, is not going to be good enough. And you're going to see a lot of spread in that context.
Now, when the Delta variant was the major variant last year, and we ended up, as you know, with 414,000 cases a day, major political rallies were held in states like Bengal, Tamil Nadu, Assam, and Kerala. And clearly, they fueled the spread of Delta. How worried would you be if this time around, when Omicron is raging, you once again have major outdoor rallies with 200,000-300,000 people, maybe more, and that will clearly fuel the spread of Omicron. But how worrying is it that this time it's Omicron that's being fueled, not Delta?
Well, it is better that it is Omicron being fueled, and for two reasons. And again, I want to keep emphasizing this point, partly because Omicron is less severe, but actually more importantly, the big difference between last February, March, April, and this January is that India is much more vaccinated. Actually, there was barely any vaccinations a year ago. And now a majority of Indians have gotten at least one shot. So that is actually what creates a far higher level of protection. So yes, I mean, again, I'm as a public health person, I'm not going to advocate for a rally with 200,000 people, even if it's outdoors. I would like to see more outdoors, and I'd like to see it a little bit less crowded. But I am less worried about outdoor activity, even with Omicron, even with a more contagious variant, because the population is so much better protected than it was a year ago.
And during an outdoor rally, is it absolutely essential that everyone have a mask? Because one of the things we all notice on television is that practically 99% do not have masks, and they are standing literally cheek by jowl together.
Yeah, that's the thing. So outdoors in general, I don't believe that you need to wear masks in general. And the one exception I make is in crowded outdoor gatherings where people are standing still for long periods of time. That's the political rally. So that is the one place where I think there's evidence that you can get spread. That is the one context in which I think a mask would be useful. And unless you really can do outdoor rallies, which are much more thinned out with far less crowds, then you can get away without masks. But you and I have both seen those rallies of hundreds of thousands of people, as you said, next to each other for hours, shouting. That's the one outdoor context in which I think wearing a mask makes a real difference.
Talking about masks specifically, given that we're dealing with Omicron, which is highly infectious, would you say that in these present circumstances, mask wearing is perhaps the single best defense for every person?
Well, I think, yes, I would say mask wearing is immensely important. And depending on the context you are in, certainly can make a very big difference. I would argue the single biggest defense, and certainly the single best defense against the thing we care about most, which is significant illness, is actually vaccinations, right? So being vaccinated, particularly being boosted, that is the best defense against severe illness. Against getting infected at all, masks make an enormous difference.
Given that you believe that vaccination is the single best defense against illness in particular, and illness is what people care about more than anything else. Right. Let me quote to you a study done by Imperial College, which has said that if you have only 2 jabs of Covishield, which is what we call AstraZeneca in India, the protection against serious illness or death from Omicron is just 20 and 30% respectively. After a booster, It shoots up to 80 and 88%. So clearly, boosters make a huge difference in terms of the protection against serious illness and death. But in India, boosters are only being given to people over 60 if additionally they have comorbidities. If they don't have comorbidities, regardless of their age, they won't get a booster. Is India right to make that distinction, or should boosters be given to everyone over 60?
We give boosters to everybody over 60. I think that the evidence is overwhelmingly clear from Covishield in India, AstraZeneca elsewhere, that boosters are important. Personally, I think boosters are important for every adult. But if you're going to prioritize, everybody over 60 should be getting one. And as vaccines become more widely available, I would be giving boosters to everybody, every adult. People under 60 with chronic disease absolutely need it. But I think everybody's better off with a booster. So I would say this really should be driven by how much vaccine availability there is, but I would expand that eligibility for boosters to everyone over 60.
Well, we know that vaccine availability is not a problem. Adar Poonawala, who runs the Serum Institute, has said that he has something like 500 million in storage just ready to be mixed, and probably another 500 million ready to go. So availability is not a problem. It's a question of the government deciding, and your advice to the government is everyone over 60 should get a booster. In fact, every adult should get a booster, but definitely everyone over 60. And this condition that you have to have comorbidities should be eliminated.
Absolutely. Absolutely. And again, this is all about prioritizing. If you have plenty of vaccines, I would personally, at this point, quickly open it up to everybody over 60. And then as that group is getting vaccinated, move down immediately to everybody over 50. And then once that group is boosted, then move quickly to every adult.
My last question, Professor Jha, and I want to put you right as we end this interview, what I suppose is the dilemma that every government, but in particular at this moment, the Indian government faces. And that is to do with how do you handle a pandemic? Do you react with the worst case scenario in mind and effectively shut down the economy, damage the education of children because you want to avoid a huge caseload, you want to avoid serious illness and death? Or do you deliberately seek to find a middle path, which then accepts that a lot of people will be infected, but the disease will be mild and they'll recover pretty quickly, but you still found a way of keeping the economy open and you haven't damaged schools from functioning? Which of the two options would you say is the best for India at this moment of time?
That's a very good question. And I think that last part, at this moment in time, is the right issue. So I'm going to answer that question with a little bit of a broader perspective. In the beginning of the pandemic, when you don't know much about the virus, you don't know much about how it spreads, you don't know how serious it is, shutting things down made more sense. It made more sense because we needed to prevent that horrible worst case scenario. We're no longer in that position. We know how the virus spreads. We know how to prevent severe illness. We know how to keep the economy going. We know that schools can be quite safe in the middle of a surge. We know all of this. This is scientific knowledge, and we have the tools. So at this point, the pandemic playbook has to be, what are the costs of policy implementations and what are the benefits? Cost of shutting down schools is massive. The benefits are trivial. Makes no sense to do that. And so what you want to do is you have a very nuanced approach where high risk things you want to try to curtail, low risk things you want to let happen. You want to keep the economy going. You know, people often say the economy versus health. You have to understand those are related, of course, right? Because if you shut down the economy, guess who suffers the most? It's the poor. And the effect is on their health. So this is not a health versus economy issue. At this point, that middle path of keep things going, use the tools you have, protect vulnerable people, use testing, use masking, shut down the highest risk activities or slow them down. That should be our strategy. We get through this surge. And then here's the last point. We get through the surge, things will get better. And we will be tempted to say, okay, pandemic over. Let's not do that. Start stockpiling for the next. build up a stockpile of billions of tests, antigen tests. Make sure we have plenty of masks. Make sure you have a good supply of vaccines. Get more people boosted. There will be future variants, and when they come, we will be able to manage them because we have all the tools in the stockpile to do it, and we'll be able to keep our economy going, schools going, and prevent people from getting very, very sick.
Thank you very much indeed for that, Professor Jha. And I think the government will be particularly pleased because in many ways you've endorsed or at least agreed with their strategy, but with two critical exceptions. Schools must be open. You cannot damage the education of your children. And as you said, we have every evidence that schools can function safely. There's no need to worry. And the second area where you do disagree is don't completely demote the importance of testing to the point where positivity seems to soar above 20%. That clearly suggests you need to do more simply because you must identify those who are infected so they don't in turn go on to infect others. But that apart, you also do believe that now, with Omicron so infectious, our primary focus should be on preventing hospitalization, ensuring vaccination, and keep a close eye on hospital figures, because that will tell you just how ill the population is becoming. Thank you very much indeed. Take care. Stay safe.
Thank you very much.